Welcome to this presentation, which forms part of the Queen Mary University of London event, Leadership in Healthcare and Emotional Resilience, Lessons from COVID-19. I'm Mandy Murdoch, and I'm a coaching psychologist who provides executive coaching and consulting services to the health sector. In this presentation, I will be discussing just a few of the reasons why it is important for leaders to consider mental health. So how common are mental health problems? According to the mental health charity Mind, in England, 1 in 4 people will experience a mental health problem of some kind each year. 1 in 6 people report experiencing a common mental health problem like anxiety and depression in any given week. The rate of self-reported work-related stress, depression, and anxiety has increased significantly in Great Britain in recent years. The Health and Safety Executive relies on the results of the Labour Force Survey. Now, please bear in mind that these results relate to responses received during 2019-2020. In other words, before the impact of the COVID-19 pandemic will have been felt. So it will be interesting to see whether the survey of the 2020-21 financial year shows any statistically significant changes. So according to the latest Labour Force survey, stress, depression or anxiety accounted for 51% of all work-related ill health cases and 55% of all working days lost due to work-related ill health. As well as the personal costs to those experiencing mental health problems, there are significant economic and societal costs associated with stress, depression and anxiety. 17.9 million working days were estimated to be lost due to work-related stress, depression, or anxiety in the 2019-20 financial year. And this equated to an average of 21.6 days lost per case. Stress, depression, or anxiety is more prevalent in public service industries such as education, health and social care, and public administration and defence. It is unclear whether the mental health of NHS staff has significantly declined during the pandemic. However, in April 2020, sickness rates for NHS staff in England were at their highest in a decade. Whether this figure includes those shielding or self-isolating is not reported. The most common reasons for sickness absence were anxiety, stress, depression, or another mental illness, reported by just under 21% of staff off sick. PricewaterhouseCoopers has cited that 40% of employees do not feel comfortable citing mental health as a reason for taking a day off work. 1 in 5 people take a day off due to stress, but 90% of these people give a different reason for their work absence. As a result, burnout goes unsupported and costs the UK economy approximately £1.4 billion per year. Results from the Mental Health in the Pandemic study show that 1 year on, the crisis has had wide and deep emotional impacts on UK adults. The research reveals some positive signs. Anxiety about the pandemic has become less common, falling from 62% of those surveyed in March 2020 to 42% in February 2021. However, the overall picture is mixed. Loneliness has become much more common, increasing from 10% at the beginning of the survey to 26% in February 2021. The number of people who said that they are coping well with the stress of the situation has fallen slowly and fairly steadily over the last year. In April 2020, during the first lockdown, 73% of UK adults said that they were coping well. And in February 2021, 64% said this. Some groups of people are much more distressed than UK adults generally. These include 18 to 24-year-olds, full-time students, single parents and adults who are unemployed, as well as people with long-term disabling health conditions and mental health problems that predate the pandemic. The Health and Safety Executive defines work-related stress as a harmful reaction that people have to undue pressures and demands placed on them at work. Another psychologically informed definition is stress occurs when perceived pressure exceeds your perceived ability to cope. The main work factors cited by respondents to surveys as causing work-related stress, depression, or anxiety were workload pressures, including tight deadlines and too much responsibility, and a lack of managerial support. There are many negative impacts of chronic stress. It leads to mental health conditions such as anxiety and depression, causes high blood pressure and chronic diseases in the brain and the heart, such as heart disease. It impairs cognitive functioning, such as memory, learning, and decision making, and can also lead to insomnia. Emotional symptoms of chronic stress include feeling of a loss of control, being easily agitated, frustrated, or moody, feeling lonely, worthless, or depressed. Physical symptoms include headaches, low energy, insomnia, an upset stomach, and nausea. And cognitive symptoms include constant worry, forgetfulness, and inability to focus. Some of the behavioral symptoms of chronic stress include a change in appetite, nail biting, fidgeting, pacing, and also an increased use of alcohol or drugs. It's important to remember that mental illness can be invisible. So you can have anxiety, but still sound confident. You can have depression, but still smile and make jokes. You can feel suicidal, but still turn up to work every day and appear fine. Research has found that individuals who have not experienced burnout are more resilient. However, people who had experienced burnout found that their ability to cope with stress was not as strong as it was before. For some people who have experienced burnout in the past, the slightest exposure to stress can cause a flooding of negative emotions previously encountered during burnout. This flooding of emotions would cause a flight response in burnt out colleagues, meaning they wanted to remove themselves from the situation rather than building better coping mechanisms for dealing with the stress or difficulty. The implication of this is that individuals who have experienced burnout will need to work even harder to build coping strategies to become more resilient. Another reason to value prevention over cure. So to summarize, mental health problems are very common. Unfortunately, due to the challenges of the pandemic, even more people are struggling to cope with stress. Even though we now tend to talk more openly about mental health, there is still a stigma attached, especially in the workplace. Employees prefer not to let their colleagues know that they are struggling to cope. This means that mental health problems are often hidden and can get worse without support, resulting in devastating consequences for individuals, organizations, and for wider society. In the next presentation, I will be talking about resilience and why it is important in leadership. Thank you.